Today, I'm going to share the findings from the work carried out by the Association of Academies and Societies of Science in Asia, ASSA, the imperative climate action to promote and protect health in Asia and Oceania. Hi, good morning. I'm Professor Dr. Victor Ho from the Department of Social and Palliative Medicine, Faculty of Medicine, University of Malaya, a member of the working group for this report. Let me share with you the background of the report and my presentation today. The information that I'm going to share in this presentation is based on the findings from the imperative of climate action to promote health in Asia report. The report is the work of the Association of Academies and Societies of Science in Asia. It is the part of the IAP project on climate change and health, which is funded by the German government. This report is the work of 15 national academies from 7 regions of Asia and Oceania: East Asia, West Asia, Middle East Asia, Southeast Asia, Oceania Asia, North Asia, and South Asia. The Asia and Oceania region is the largest region in the world, stretching from Turkey in the west to Japan in the east, and from Russian Federation in the north to New Zealand in the southern hemisphere. It's the most diverse climate variation from desert to lush forests. From the highest mountains in the world to the lowest depth in the oceans. It is also one of the most vulnerable regions to the effect of climate change. This is because the region has the highest population, 4.6 billion, which accounts for 60% of the world's population. It has countries with the highest population density, with up to 1,265 people per square kilometer in Bangladesh. The region's urbanization ranged from 21% in Nepal to 92% in Japan of its people living in the cities. Has some of the longest stretches of coastal area, which is prone for flooding and rising sea levels. Topping it up, many of the countries in the region is still largely dependent on agricultural economies. The region is also disaster prone with extreme weather events. And due to the large number of people and high population density, a large number of people have been affected by natural disaster over the last decades. Since 2000, more than 1.2 billion people in the region have been exposed to hydrometeorological hazards. There were more than 1,200 disaster events happening during this period, which accounts for a global human exposure of 91% of tropical cyclone, 92% of floods, and 66% of landslide based on per head basis. From 1970 to 2011, more than 2 million people were killed because of the natural disaster, which accounts for 75% of the global fatalities. The risk of people exposed to flooding and living in cyclone-prone areas are doubled from 1970 to 2010. More than 60 million people are exposed to flooding risk, and more than 120 million people are residing in cyclone-prone areas. Climate change includes vector-borne diseases and infectious diseases, flood and infectious disease, malnutrition, particularly undernourishment and stunting, air pollution and allergies, air pollution and cardiovascular health, effect of forest fire, long-term impact of human fertility and forced migration and mental health issue has been observed in different extent among countries in this region. There's also a problem of direct and indirect heat-related effect and environmental toxicant. The health effects due to climate change are different for different countries in this region, depending on the relative changes in the weather and the vulnerability of the population. Direct effects of heat include heat illness, exacerbation of pre-existing health condition, and increased hospitalization. The direct effect of heat includes heat rash, heat cramps, heat sinkhole, heat exhaustion, heat stroke, and ultimately death. Heat can also exacerbate pre-existing respiratory and cardiovascular condition. The effect of heat does not only depend on absolute temperature, but also on the relative change in temperature. In New Zealand, condition where the temperature is above 25 degrees is considered hazardous and leads to increase in heat-related morbidity and mortality. Heat can also cause indirect health effect on pre-existing medical conditions such as cardiovascular disease, respiratory condition, mental health, diabetes. People with pre-existing medical condition may be more prone to develop heat exhaustion and heat stroke. With more and more people moving from the rural area to live in the city, urban heat island will become a problem in the future. For example, in Australia, 90% of its population that is living in urban area will be affected by heat. The heat vulnerable index of Australia is also high and upward trend. An increase of 1.2 to 2 degrees Celsius will lead to more than 27,000 heat-related deaths annually out of the 830 million urban inhabitants in China. Impact on health services. Increased ambulance call-out or slower response time due to heat stress, increase in hospital admission, increase of accident, example drowning, work-related accident, injuries and poisoning, increase in transmission of food and waterborne diseases, and bloom in marine algae, potential disruption of power, water and transportation, and decreased productivity. Increased heat also affect outdoor workers like in agriculture, forestry, fishery, leading to heat stroke and decreased productivity. Cold event can occur due to the effect of climate change and pollution. Smog formation from human activities was attributed to increase in cold wave in Nepal, with 58 locations affected in 2010. Bangladesh also has seen severe cold events in the past 2 decades, and in China, cold-related mortalities outnumber heat-related mortalities by 20 times. Forest or bushfire can occur naturally due to prolonged dry days from reduced precipitation and high temperature. It can also occur due to human activities or biomass burning for agricultural activities. It is a recurring issue in many countries in the region, including Australia, Armenia, Azerbaijan, Indonesia, India, China, Malaysia, New Zealand, Singapore, and Turkey. Fine particulates from the fire is hazardous to health and can travel very far, even across seas. The fine particles from the fire in Australia have been found to cross the Tasman Sea to New Zealand. Similarly, fires in Sumatra, Indonesia has crossed the Strait of Malacca to Singapore and Malaysia. There has been increasing forest fires and more people are affected by fires. Here are some examples from China, India, Turkey, and the Russian Federation Far East. Forest and bushfire releases sulfur dioxide, nitrogen oxide, ozone, carbon monoxide, and total suspended particles in the form of particulate matter P10 and P2.5. It can affect cardiovascular, respiratory, and psychological health of suspected individuals. Flooding is a major issue in most countries in this region. Global warming leads to excessive precipitation and increased sea levels. Excessive melting of the Himalayan glacier leads to flooding in Nepal, India, Pakistan, Bangladesh, and Bhutan. The Ganga originates from Lake Manasarova in the Himalayas. More than 400 million people live in the river basin. In China, half of its people and two-thirds of the land falls under the heavy threat of flood. In the last 30 years, the frequency and severity of extreme floods have increased. Similar situation has been experienced in New Zealand, Armenia, and the Russia Federation Far East. In China, infectious diarrhea increased by 4.8% during flood years. Flood in Solomon in 2014 leads to national outbreak of diarrhea diseases caused by rotavirus. Outbreak of diarrhea diseases and from cholera, rotavirus, and leptospirosis. Following floods in India and Bangladesh. Floods due to cyclone also caused displacement, leading to sanitation and hygiene issue. In Australia, floods leads to increase in dengue and leptospirosis. In New Zealand, flooding in 2015 and 17 leads to the dispersal of toxic chemicals, dam houses, and mental health issues. In China, acute death among women in flood were higher than in non-flood years. The threat of changes in temperature, precipitation, and increase and decrease in humidity leads to the profound impact on the life cycles and growth of infectious agents and vectors. It can lead to impact on access to clean water and increase in polluted water, can also increase the threats of infectious disease. The diagram summarizes the effect of change in climate, extreme weather events, and the indirect effect of some of the pathway for infectious disease threats. Infectious disease threats include waterborne diseases, foodborne diseases, and vector-borne diseases. Here are some examples of issues faced by countries in this region. Pakistan has the highest incidence of typhoid fever in South Asia. In Nepal, the outbreak of food and waterborne diseases is becoming more common. The risk will increase with increase in temperature and rainfall. In India, the issue is the lack of access to clean water, which is further worsened by depletion of the groundwater due to drought. The changes in the temperature has led to the changes in exposure to pathogenic microorganisms, as shown in Korea and Japan. Next, we come to vector-borne diseases. Some of the vectors include mosquito, ticks, sandflies, and fleas. The changes in temperature has led to the emerging and re-emerging of vector-borne diseases in areas and countries where previously it was not an issue. In many temperate countries, the Aedes mosquito are now present in their environment. Climate change will lead to higher risk of food insecurity and malnutrition. Studies have shown that the elevation of CO2 levels can impact on nutrient concentration in food, which can lower the iron, zinc, and protein levels in plant-based food. Many of the countries in the region will depend on plant-based food. The rising sea surface temperature also correlates with the microorganism and biotoxin levels in seafood. It also increased the rate of methylmercury formation in countries where seafood is consumed widely, like Japan, New Zealand. This will become an issue. Malnutrition and anemia is a major health threat in both developed and developing countries. In developing countries, chronic malnutrition can lead to stunting and wasting and underweight. Stunting is a problem in South Asia, particularly in Nepal, India, and Pakistan. The diagram shows some effect of global warming on agriculture. It can lead to loss of fertile coastal lands caused by rising sea levels. loss of biodiversity, increase in extreme weather events leading to more unpredictable farming conditions, and increased incidence of pest and vector disease affecting plants and livestock. Effect of air, water, and soil pollution with the environmental toxicant directly from human activities or indirectly from the effect of climate change can lead to adverse health outcomes. In a study in Malaysia, researchers have found that climate change influenced female fertility. The diagram explains that multiple rules were changed in female fertilities due to effect of climate change. Mitigation and adaptation. Mitigation is reducing the severity of climate change by preventing or minimizing factors that cause it, such as emission of greenhouse gases. Adaptation is the adjustment of reaction to the current and future effect of climate change, such as preparation for the change it will bring. Mitigation includes reducing greenhouse gas emission, enhancing greenhouse gas sink strength, long-term focus on avoiding future impact, global scale of cross-sectoral effect needs for effectiveness, local and sub-national nesting of collaborative needs. And adaptation is by reducing vulnerability, enhancing adaptive capacity. Start with the focus on the current variability, local scales and cross-sectoral effect needed for effectiveness, sub-national and global collaboration needed. The Asia and Oceania region needs an integrated mitigation adaptation strategies tailored for its own needs. The countries are facing difficulties in implementing mitigation and adaptation plans due to economic capacity and lacks of trained human resources. The National Adaptation Plan for Climate Change and Health. Accumulate scientific data and knowledge on climate change to fill the evidence gap. Increase evidence-based research and studies capacity related to climate change and health to identify the most pressing health threats from climate change. Cooperation between relevant ministries and agencies within and between countries needed for timely information and data sharing. Increase awareness among the general public, policymakers and healthcare providers, in addition to promoting effect by companies and local governments. Structural surveillance, monitoring and reporting system. Strengthen the capacity of the healthcare system to cope with the health effect of climate change. Reinforce health preparedness and response at national, state and district level. General points for effective mitigation adaptation. The important communication across different sectors. Develop and pilot early warning system for heat wave and health risk factors. Research and studies on the prevention and control of climate change related diseases. Enhancement of healthcare system. Social transformation to help promote awareness and control and to improve water quality, sanitation and hygiene levels. Development of technology for adaptation and optimization of agricultural sector. Co-benefit of mitigation. There are different co-benefits for mitigation, includes transportation change, zero emission cars, active transportation and public transport. Household energy consumption change to reduce greenhouse gas emission and to reduce pollution. Encouraging healthy lifestyle, active transportation reduces both greenhouse gas and improve health. Improve housing, reduce the heating and cooling costs, reduces greenhouse gas. Dietary and food system, change in diet, more plant-based diet reduces greenhouse gas. Agriculture and forestry and technological transfer. Co-benefit from actions on agriculture and food system, exploring roles of community forests, ethanol production and fuel substitution, climate smart villages. Common challenges in Asia and Oceania. low public awareness, insufficient research, inadequate data and limited access to data, limited healthcare facilities and resources, insufficient financial and economic support, impact of high financial and disease burden, especially on the poor. Conclusion. Climate change is happening on a wide regional scale and escalating. Climate change affects the health through multiple pathways. Identify regional variation on impact, solution, science-based evidence and avenues for regional cooperation for mitigation. Identify new research area, increase transdisciplinary and intersectoral information sharing on the outlook of public health issues associated with climate change. Accumulate the use of evidence on the health impact of climate change from reports to emphasize the basis of coherent health policy development for climate change mitigation adaptation strategies. Increase responsiveness to health impact on climate change, as well as promoting action that improve health while reducing greenhouse gas emission. Certify public health issue. So clarify public health issues associated with climate change that should be addressed throughout the multilateral collaboration. Highlight the common needs for national planning. Dealing with new and emerging health issues in Asia and Oceania is the face of climate change. A common solution of one size fits all may not solve complex problems faced by people in different socio-economic and political systems. Recommendation: education and training, research and knowledge implementation, integrated health facilities, services and implementation, government support in policy development, financial aid and adequate resources. We only have planet Earth. It's time to act. Thank you very much.